Pranam, Jai Jinendra, everyone, and good evening. Welcome to our 11th hour Oshwal Wellbeing and Lifestyle webinar. And today we are going to be talking about strokes, prevention of strokes and recovery from strokes. But I'd like to introduce first Jayesh Bhai, who will be reciting the Navkar mantra. Thank you.
Om Namo Arihantanam. Om Namo Siddhanam. Om Namo Ayariyanam. Om Namo Uvajjayanam. Om Namo Lo Esabvasahunam. Eso Panchanamukaro. Sabbapavapanasano. Mangalanam cha Savveshim. Padhamam Havai Mangalam. Arhanto Bhagavanta Indra Mahita Siddhascha Siddhi Sthita Acharya Jina Shasano Natikara Pujya Upadhyayaka Sri Siddhanta Supatheka Munivara Ratnatraya Radhika Panchaite Parameshtina Pratidinam Kurvantu Vo Mangalam Kurvantu Vo Mangalam. Oshwal Association of the UK તરફથી આપ સૌને પ્રણામ. આપ સર્વનું આરોગ્ય સુખાકારી સારી રહે અને ખૂબ સારા કાર્ય કરવાની શક્તિ દેવ ગુરુ અને ધર્મ પસાએ પ્રાપ્ત થાય એ જ પરમાત્માના ચરણમાં વંદના અને પ્રાર્થના.
Thank you, Jayesh Bhai. So આપણે આજે આપણી સમક્ષ છે ત્રણ લોકો જે આપણે આજે સ્ટ્રોક્સની વાત કરવાના છે. પહેલા છે Dr Ameet Bakhai. He's the Research and Development Director and Consultant Cardiologist at the Royal Free London NHS Trust, a Harvard Scholar, a Fellow of European Society of Cardiology, and a steering group member for the UK Research and Development Leaders Group. Ameet Bhai has enabled innovation of drugs, devices, and diagnostics in multiple cardiac areas of heart failure. He is a founder, author, and has published over 100 papers, received a national award for a decade of work in clinical cardiovascular research from the Royal College of Physicians, and is recognized for his passions in clinical trials and research, technology, innovation, health economics, and digital integration. Joining us also is a colleague of Ameet Bhai's, the eminent Dr Heather Angus Leppan, who trained in Sydney, Oxford, and Cardiff, and is a consultant neurologist and epilepsy lead at the Royal Free and Barnet Hospitals. She is also honorary senior lecturer at the UCL and Imperial College, and president-elect of the Clinical Neurosciences section of the Royal Society of Medicine. We are very, very pleased to have you with us today, Heather. She's also past honorary secretary of the Association of British Neurologists, and her research interests are in epilepsy and migraine. Joining them, we have Chetan Bhai Shah, who is going to be sharing his amazing lived experience of having had 2 strokes and then his recovery. A remarkable story that I'm sure is going to be very interesting and moving for all of us. With us also today is Nistha Malviya, a highly specialist neurophysiotherapist with the Central and Northwest London Clinical Commissioning Team, working across North and West London plus Central London. Nishta's work involves intensive therapy for stroke patients, getting them back to health. So આજની આ સેશન ખૂબ જ બધા માટે ઘણી બધી ઇન્ફોર્મેશન આપણે મળવાની છે. પ્લીઝ તમે બધા તમારા જે પણ ક્વેશ્ચન્સ હોય અમારા સ્પીકર્સ માટે તમારા ક્વેશ્ચન્સ આપણા ક્વેશ્ચન્સમાં યુટ્યુબ પર પોસ્ટ કરજો અને એટ ધી એન્ડ આપણા બધા પેનલિસ્ટ આ ક્વેશ્ચન્સ જેટલા અમે આન્સર કરી શકશું એટલા અમે આન્સર કરવાની ટ્રાય કરશું. થેન્ક યુ. તમે બધા આ ઓશવા વેબિનારમાં જોઈન થયા છો. Once again on a Thursday evening. We are back and they're going to be now every fortnight on a Thursday at 8 o'clock. So thank you very much. Badai Jenna join Karuche. Today's webinar promises to be incredibly interesting and one that I'm sure lots of people are going to find very helpful. So without further ado, I'd like to introduce now Tushar Shah, President of Oshwal, Vice President of Oshwal Association of the UK, who's going to give us a warm welcome. And then we will go to our first speaker for today, that is Chetan Bhai, who's going to share his amazing story with us. Tushar Bhai.
So thank you, Prafulabin. As explained by Prafulabin, today is a very important topic: strokes, prevention and recovery. Now, all of us, whether it's a family member or somebody close related to us or a friend or somebody, we will all know somebody who is probably in their old age or slightly younger age, is it a heart attack, minor stroke, whatever, and the difficulties that they face through. And today's topic is such an important topic that will affect all of us sooner or later. And so we're glad that we've managed to find these three professionals who've given up their valuable time to join us today and give us all this advice. And do take it all in. And of course, Prafulabin and Kitu, do post your questions on YouTube channel, and we will do our best to answer as many as possible, time permitting. As usual, we may sometimes run out of time, so our apologies on this and Michhami Dukram. So without taking any further time, we start off with Chetan by now and his life experience. Thank you, Prafulabin.
Thank you to Shabai and Popula. My name is Chetan. I'm married. I've got a 4-year-old daughter, and I had my first TIA, which is like a mini stroke, in 2016. That happened a week before Nikita was born. So my wife had to go through late pregnancy and obviously my issues during that period. In February 2018, I also suffered a full stroke. Back then, my wife and I couldn't understand why. I used to play tennis 3 times, maybe 4 times, maybe 5 times a week. I had not one risk factor. My blood pressure was normal. I had no heart issues, no diabetes, and still to this day, not one doctor can pinpoint any reason for why the stroke occurred. When a stroke happened in 2018, I suffered speech slurring. I was unable to walk properly. I lost my left side coordination, which basically said, my brain said one thing, but my left side of my body did another. Memory loss. My vision was also impaired. That basically made me give up my passion. My passion of tennis was gone. Because I couldn't run, because I couldn't walk, because I couldn't coordinate myself. My little daughter, she could walk and run faster than me. That's not fair. Anyway, after my stroke, I had therapy and physio to help my recovery. This lasted about 6 months after my stroke. However, it's not enough. Medication-wise, I take a daily dose of clopidogrel, and this helps me to keep my blood thin. I still struggle to come to terms with what happened, and I went through a lot of mental anguish and a very small form of depression, and I kept asking, why me? Why? Today, I still struggle with balance and walking. But in 2020, in July, I found a new passion, cycling.
So, Chethan, that's such an amazing story, such a struggle. But you met your hero, John Barnes, recently. Tell us more about that and cycling.
So in July 2020, I started cycling. The main reason why I started cycling was, one, to actually help progress of my ability, but also two, I was actually speaking to a friend of mine, and we said, why don't we do something? And that in turn caused us to actually start a cycle charity ride from London, Wembley, and there's all the pictures from the actual day we started, riding all the way to Liverpool. That's 253 miles we covered, and I cycled all that in 4 days. In those 4 days, we went from Wembley to Milton Keynes, home of the MK Dons, from Milton Keynes to Leicester, home of Leicester Football Club, Leicester to Crewe, home of Crewe Athletic, and then from Crewe to Liverpool, Anfield, and that's home of my beloved Liverpool Football Club. At the finishing line on the Wednesday, my shock when I was greeted by my childhood hero, John Barnes. What an event, what a finish. We started off this charity ride to raise £10,000. On the actual donations page, we raised just under £18,000. We've also raised 2 raffles, which we raised another £6,500. So altogether, we've raised over £24,000. We've smashed our target. And do you know what? This whole journey has been a positive influence on me and all the people around me. My wife, my family, all my friends have helped me support this. We've raised money for food banks, the Toy Appeal Project, and Project Giving, the 23 Foundation. These are all charities which are close to my heart. And also with the pandemic that's been going on, we found a way to help myself, but also to help them as well. Due to this charity ride, I now have the passion to actually do more. So next year, I'm going to be doing Liverpool again, but also I'm looking to do Paris. So London to Paris next year. Thank you, guys. That's my story.
That is absolutely an incredible journey, and well done you. Really, really, I'm sure it wasn't easy. I'm sure you've had a lot of struggles along the way, and what an inspiring thing that at the end that you and your 7 mates have done that amazing journey from Wembley to Liverpool, raising amazing amounts of money for charities. We'll come back to you later in the Q&A to talk more about how you've done some of this, Chethan, but thank you so much for sharing your story with us. I'm going to introduce our second speaker now for this evening. He is Ameet Bakhai. We talked about him earlier. I'm not sure he heard my introduction, but he is here now. And Ameet Bakhai has done a phenomenal amount of fantastic work already in raising awareness of health issues, and particularly his research concentrates on prevention. So we're going to go straight to Ameet Bakhai, but also joining him today is Dr. Heather Angus Leppan, neurologist from the Royal Free NHS Trust. So we have 2 very fantastic, eminent medics with us, and they're going to do a double act today to talk about all things prevention, but also some of the things that perhaps we think are strokes, but actually there may not be strokes. So welcome both of you. I hope all of the tech works today. And I'm going to hand over to you now. Thank you. You're on mute.
You're muted.
That's a classic mistake, isn't it? We all make it. And that's probably the best way to be, actually. You know, most of our language is body language. So 85% of our language should all be about being positive. And actually what Chetan has just said, you know, how can you follow that? That focus, that clarity, that purpose that you're demonstrating in the face of adversity, that is the human spirit that cannot be conquered. And that is life. You know, that is such a joy to witness. So thank you so much, Professor Ben and Chetan. And it's lovely to speak with both Nistha and my great friend, Professor Heather Angus Leppan, who's our stroke and neurologist, who's our neurologist at Barnet Chase Farm Royal Free and the Royal Society of Medicine and many other places. And she's at the last minute joined me because she heard we were doing such cool stuff. So thank you for that. Today, we're really about prevention. We're trying to tell you about all the things that will help us avoid these disasters, avoid these fires, these bomb blasts that can occur in life. And it's really important that you do take this time to do prevention. And the first thing I want you to do is, if you haven't done your 5,000 steps a day today, then after this talk, I want you to commit to going for a walk. It's so important that you take the chance to just enjoy mobility. That same thing that Chetan has just mentioned, that his daughter was doing so fast, which many of us will take for granted. It is critical that you do that every single day. There is a very simple message. Use it or lose it. Nothing complicated. Okay, so let's talk about stroke. You've invited me deliberately to talk specifically about stroke. Can you see these slides? And Heather, do say hello.
Hello, and thank you for inviting me to be here. It's a great honor. And yeah, we can see your slides beautifully, Ameet.
Oh, thank you so much. Fantastic. So these are slides that I owe my research fellow, Leah McCauley. Thanks for helping us put them together. You can imagine that at the moment the hospital is incredibly busy. We've got so many people coming towards A&E with so many different ailments and so forth. And so we're running really quite ragged with so much, you know, things to catch up on, because for 19 months, not everybody has used that time and able to be healthy. And there are many people who have been isolated. There's some background noise there. And just to say that over those 90 months, many people have safely stayed at home and protected themselves from an infection, but unfortunately, their weight may have increased, their bone and muscle mass may have gone down, and so their ability to be mobile has gone down. And so people are at risk of stroke whenever they have slow flow of blood. So think about that. Slow flow of blood equals clots, and those are the majority of reasons that we get strokes and brain damage. Let me just demonstrate. So these slides, there are two types of strokes. One is when a blood vessel in the brain gets blocked because of slow flow and clots occur. That clot can occur inside the blood because of slow flow, or a clot can go from the heart or from any of the vessels in the upper part of the body called the aorta, or into the carotid arteries, can go to the brain. So any clots occurring inside your vessels, if your vessels are furring up like your carotid arteries, like the heart, inside the heart valves, any of these things that can occur, if your heart is beating erratically and the blood is not moving regularly and flowing smoothly, if you have conditions called atrial fibrillation, if you've recently had a heart attack and your heart is not pumping as well as it should, and the scar is occurring, then inside the heart, clots can occur, and they can go to the brain, block vessels. Now, a lesser amount of time, 1 in 6 times, there are blood vessels that can burst inside the brain, or you can have bleeding from trauma outside the brain, pressing on the brain, that can also lead to strokes. But this is a less common cause of strokes, a bleeding vessel, mainly due to high blood pressure, diabetes, conditions that cause blood thinning, you may even be on blood thinners and so forth. And if you've got uncontrolled blood pressure on top of blood thinners, then you can get bleeding inside the brain. But the majority of times, we are harmed by our own body through clots. Clots in the heart arteries, clots in the brain arteries, clots anywhere inside the lungs. When COVID hit, we've had a lot of patients during the hospital getting slow flow of blood inside their lungs, and they get blood clots inside their lungs. Very similar if you've been on a long flight and you get clots in your leg, those clots can move to the lungs. So anything that causes slow flow, you sitting down for a long period of time in a difficult position, or being on a ventilator with COVID, etc., all of these things can cause strokes. Okay, different parts of the brain represent different parts of our body. So you can see here that there is a section in the middle part of the brain that represents all our muscles. There's another section for sensations. At the back of our head is our vision. At the front of our head is much more about speech and thinking and cognitive high-level thinking. So these areas, any of these areas can be damaged by the blood vessels supplying them and lead to different signs. Now, these signs that are really important that I want you to remember is an algorithm called FAST. Now, FAST is really important because the quicker we help that clot move away, dissolve the clot in the blood vessel, the quicker we protect brain. So time is of the essence when we're worried about the brain going wrong. And these FAST signs are as if your face is weak on one side. So if suddenly your eyes are going like that, or your face is going like that, so your muscles suddenly become weakened on one side of your face. If your arms are weak on one side, suddenly you can't carry a cup of tea, or you can't use your fork, or you can't use a newspaper properly. If your speech, if you're having trouble finding the words, or if you're having trouble saying the words, articulating the words, and you're saying gobbledygook, you're not saying the right things, any of these three things could be a stroke. Please dial 999. Please tell the ambulance, hey, I think somebody here is having a stroke, or I'm having a stroke, and they will rush to you, and they will very rapidly get you into a hyperacute stroke unit. Heather, which are our nearest hyperacute stroke units that most of our North London patients would go to? I'm aware of Northwick Park.
Yeah, Northwick Park and University College London.
UCL.
Those would be UCL. Those would be the two. Yes.
Fantastic. And I think Queen Square also takes some of the pressure from UCL if there's too much going on at UCL. Is that correct?
Yes, yes. Anyone who's in that situation, a bed will be found for them. So, yeah.
And tell me if I'm right that within 15 to 20 minutes, if the callers arrive from the ambulance to the hospital that this person is potentially having a stroke and these signs are occurring, they'll arrive at a back ambulance door to a specific unit called a CT scanner, where they will get brain imaging very rapidly so that we can see that it's not a bleed, that it's a clot, and then you may be eligible for blood thinning therapies or blood thinning procedures. Is that correct, Heather?
That's absolutely correct. The system for really making sure people have a very rapid scan and a very rapid assessment by super experts is well in place. And at the moment, the treatments are blood thinning agents, as you said. In the future, I'm sure that the move will be to actually taking out the bits of clot, as is done for acute heart attacks. So our approach to treating brain attacks is getting better and better all the time. And so we can, there used to be that if someone had a stroke, no one thought it was urgent, but there's a real understanding of the urgency of it. And that's been a real game changer.
And many of the times it won't be necessarily a stroke that's causing your weakness or your facial droop, etc. Will there be other things that are causing those? Because my understanding is that probably around 1 in 6 of those is a true stroke, and often there are different things that can cause that.
That's absolutely correct, Ameet. The mimics of stroke are very important, and the most common one is migraine. where you can get weakness that can look like a stroke, but in the setting then where it usually comes on more slowly, it sort of marches across rather than coming on very, very suddenly. And then with a headache, and to distinguish them really requires the expertise of the specialist. And that's why if there's any doubt, even if you think maybe it's just a migraine, don't hesitate, call the ambulance, get to the center. It is sometimes, you know, that's much better to do that, better to err on the side of caution than to just wait and see what happens. So yes, a big part of the job of a hyperacute stroke unit is to look out for stroke mimics, which are most commonly migraine or epilepsy, or sometimes other causes, and to differentiate those. So that's a really important point.
Thank you. And then I'm just going to say that in Gujarati if I can, and Prafula Ben, please join in if you want to, because my Gujarati, my understanding is really good, but my speech can sometimes be a little bit rusty, etc. So આપણે શું વાત કરીએ છીએ કે તમને વાત બરાબર ન કરી શકે, કે તમારું ફેસનું મસલ્સ કાંઈ વીકનેસ આવી જાય, કે બરાબર ફેસ નથી બરાબર લાગતું તમને, ને કાંઈક સડનલી આવું થયું હોય કે વિઝન બ્લાઇન્ડ એક સાઈડમાં થઈ જાય, કે નોઇઝ નથી સાંભળી શકતા એક સાઈડમાં, સડનલી એવું કાંઈક થઈ જાય, તો તમને વિચાર થવો જોઈએ કે તમારા હાથ કે પગ વીક થઈ જાય, તમને વિચાર લાગવું જોઈએ કે કદાચ આ સ્ટ્રોક હશે, તો એમ્બ્યુલન્સને ફોન કરવો જોઈએ. Prafula Ben, have I said that correctly?
You've said that brilliantly. So well done. Yes.
But please feel free to, you know, reiterate and join in the conversation. And Chetan, you've said things beautifully as well. Now, what are the causes of strokes that we can prevent? And I've explained one to you really importantly, which is blood pressure. Everybody should know their blood pressures all the time. You should be monitoring your blood pressure, particularly if you're having headaches, particularly if you're feeling tired. Please check your blood pressure. Many of us never touch cigarettes ever, and so that is not an issue, but smokers will be at greatly increased risk. People who drink excess alcohol will be greatly increased at risk, because alcohol can not only swing your blood pressure up and down, it can weaken your heart and give you irregular heart rates. Being overweight will put pressure on your lungs at night and on the right-hand side of your heart. You're snoring really loudly, and sometimes you'll stop snoring. You may have something called sleep apnea, and in which case your heart will be erratic under a lot of pressure. So if you've got a lot of weight around your neck and you're a big snorer, and sometimes you stop snoring in the middle of the night and somebody's having to nudge you to make sure you're still alive, that heart is erratic and can be at risk of getting clots, and you can wake up with a stroke, and that's a really dangerous setting. So all of these things are the wrong things that will cause stroke, and the right things that will prevent stroke is, of course, the walking, the good diet. We're vegetarians, most of us, so we're really blessed in that sense. We eat a lot of fruit and vegetables, and we take a lot of juices, you know, particularly beetroot juice will lower blood pressure. Pomegranate juice will give you better, good cholesterol. And so will black grape juice. So these are the things that are normal and natural to us. So I think these are the lifestyle factors that we can change. And of course, sleep and stress and depression will also put you at risk of being vulnerable, of getting slow flow blood, and then again, giving you high blood pressure and then strokes. Now, just to say, the brain is really interesting. If you have damage to one side of the head and the brain, it's the other side of the body that might be weakened. And we can see here that if you have a damage to the left side of your head, then actually often it's the right arm, and it's difficulty forming the words and comprehending and memorizing, you know, where did I leave my keys? Have I left this on, etc., etc. The other side of the brain, you're not able to actually, you're slurring your speech, you're not able to articulate your words, even if you can find them. So the left-sided thing, again, you can get perception deficits, you can't see properly what's there, etc. Heather, did you want to mention anything interesting about the brain in this section?
I think you make a very good point that obviously exactly where the stroke occurs is going to determine what happens to the person. And I'd just like to highlight the point about brainstem strokes, which are in this sort of central hub where all of the the things like breathing, blood pressure, and so on are regulated, they're often the most difficult and unrecognized. And they usually present when someone has slurred speech and they're unsteady. They look as though they're drunk, and they may have double vision, and they may have tingling on their face. So these are more difficult to capture in the FAST, the FAST slogan that's really useful. So I think we all need to be aware of brainstem strokes, particularly. This area where there's so much, it's like the traffic center for all the impulses coming up into the rest of the brain and going down to the rest of the body. So yes, it's lots of different outcomes can happen depending on where the stroke is.
And in particular, the swallowing one, all of a sudden I'm not swallowing properly, or all of a sudden I'm seeing double vision. So those, as you rightly mentioned, those are really interesting and important ones. Fantastic. So these now are the two slides that are really important for us as doctors to discuss with you, us as clinicians, as pharmacists, as physiotherapists to discuss with you, our nurses. And that is, we've talked about high blood pressure. High cholesterol is also fundamentally important to make sure you know what your cholesterol levels are and bring them down. A really good cholesterol is anything total cholesterol below 4 and a good cholesterol higher than 1.5. So good cholesterol, which is called HDL. Higher than 1.5, really good. Now, if your total cholesterol is above 5, 6, 7, 8, that is really dangerous. So particularly the 7s and the 8s, that might be in the family. You might have a genetic abnormality, and those must not only be sorted out really quickly, but you must get your family members screened. If it's over 7.5, it may be a genetic problem that you've got that is in your family, and your children, your brothers and sisters, and even your parents need to be screened for high cholesterol. Really important point. We can come back and talk about that another time. Diabetes, where it thickens the blood because of sugar in the bloodstream. They always have high blood pressure as well. They get kidney damage, so they have sticky platelets. So the bloodstream of diabetics can, again, if your diabetes control is not good, you'll be at risk of a stroke. Same with that irregular heartbeat I've already told you about, stress, depression, and of course, heart attacks. And then women who might be taking the pill. For example, in the first 5 years of taking the pill, there's a very slight increase in the risks of a stroke. Hormone replacement therapy, certain types of hormone replacement therapy can also give you a slight increased risk of a stroke in those early years. So just bear that in mind. Now, those risks are really small, and so overall, the increase is very small as well. But these are the particular components, and of course, exercise, eating well, etc. Heather, did you want to touch on anything there?
I think you cover that really well. I think the point is that obviously part of our risk for stroke are genetic factors which we can't influence, but we can do so much about all the other factors. And going back also to what Tushar said, we're all in this together. So as parents and as wives, for example, we have we can do a lot by making sure that the diet we offer our family is healthy. Resist the urge to always give chocolates and sweets and cakes, and maybe have more fruit and vegetables. I think those sort of things make a very big difference. So the other thing to emphasize is that the benefits of these healthy lifestyle factors are enormous, not just in preventing stroke, obviously, and heart attacks, but also in preventing dementia, because these same vascular factors are the chief cause of dementia. So if you influence this, you will actually reduce your risk of having dementia. And also in terms of preventing depression, exercise is a source of making endorphins and all these natural great chemicals, serotonin, that make you feel really good. So benefits all around, and if we can all just be aware of that, then it's a real encouragement to follow this healthy life.
Perfect. એટલે હું તમારા ઉપર એક રિસ્પોન્સિબિલિટી મૂકવાનો છું કે તમારી પાસે તમારું બ્લડ પ્રેશર, તમારું cholesterol, તમારું sugar level બધાને ખબર પડવું જોઈએ. Every year you must check your cholesterol, you must check your sugar, અને તમારે ખબર પડવી જોઈએ કે exactly તમારો blood pressure and heart rate શું છે. Now, Prafulaben, did you want to reiterate any of that?
ના એ તમે advice આપી બહુ જ સરસ છે, and I think absolutely we must know those figures. જો આપણે સમજ પડશે ને આપણે ખબર હશે જ તો જ આપણે એનું કાંઈ કરી શકશું. And Heather, you've also given us some amazing, really helpful information there about dementia, because that of course is the other big issue right now that we see. So no, carry on.
Prafulaben, I know that we'll come back to, there are so many different types of medications we can now use to protect you from getting strokes, either the first stroke or second stroke. So blood thinners, aspirin and clopidogrel and normal blood thinners, Chetins on clopidogrel after a stroke. If he had an irregular heart, which he won't because he's so healthy because of his cycling, but if he did have an irregular heart, which a lot of older people will have, then you'll be on blood thinners. In the old days, you'd be on warfarin. Now you'd be on some of these newer medications which don't need blood tests regularly, apixaban, edoxaban, dabigatran, rivaroxaban. Cholesterol lowering, we've got so many different medications to lower cholesterol, both tablets and injections now. There's a new medication coming out that we hope will show its benefit of lowering cholesterol. Now, it's already proven it will lower cholesterol, but it will show its benefit for protecting you from strokes. And that one is an injection that you have, the first two injections are 3 months apart, and then you have injections every 6 months to lower your cholesterol. Now, these PCSK9 injections are every week, every 1 to 2 weeks, for example, and they lower cholesterol by 50%, and they've already been shown to reduce heart attacks and strokes. So they are already proven and already available. So beyond the statin tablets that everybody is on, there are ezetimibe tablets, there are PCSK9 injections, and there are 2 new compounds called bempedoic acid and inclisiran injections. So we've got a lot up our sleeve to get your cholesterol right. Now, for diabetes, one specific drug that has really been shown to reduce stroke is called Trulicity. It's an injectable that you're on, and that again lowers both your sugar and your risk of stroke. And then we've also got something called SGLT2s like dapagliflozin and empagliflozin that generally protect you from cardiovascular death. And so some of that benefit is through strengthening your heart and protecting you from stroke. And then, of course, all the blood pressure lowering medications we've got. Now, I won't dwell on this slide. There may be some questions coming through on that. What I do want is this message that you should know your cholesterols, you should know your blood pressure, you should know your sugar levels. But it's my job also to tell you about picking up an irregular heart rhythm. So a lot of people will have a heart rhythm, boom, 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 very nice and regular. If you have a heart rhythm goes boom, 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 and the music is no longer regular, that means you may have an erratic heart rhythm called atrial fibrillation. If that is happening, આપણે કહીએ કે ગભરામણ થાય છે આપણું હૃદયમાં કે હાર્ટ બરાબર નથી બીટ થતું કે કોઈ વાર બીટ્સ એક્સ્ટ્રા થઈ જાય છે કે મિસ થઈ જાય છે, એવું બધું થતું હોય તો પછી learn to use an ECG device or get yourself an ECG either through the GP or any of the pharmacies that are doing that or the hospital. Now, you can see in the top figure here, there are 2 figures I'm showing you here. Top figure has a very nice regular pattern. Boom, 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 just very beautiful. And the other one at the bottom, boom, 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 boom. So that rhythm is erratic. The blood is not flowing properly. That is really fundamentally a problem that you must get onto blood thinners. Now, many people have learnt to use this device on their own. You can purchase this. It's called an Alive Core. It's the new way that everyone can look at their own ECGs at home with the family, etc. You can actually hold this little credit card device, which has got 2 metal strips on either side and a strip at the back of the device to hold onto your knee or your leg. And on your mobile phone comes this beautiful ECG, and it can tell you if you're getting an erratic rhythm called atrial fibrillation. If you do have atrial fibrillation, we can thin your blood down the same day that we find this, and we can protect you. And we believe in this country, if we absolutely manage this condition of atrial fibrillation, we will probably prevent about 25,000 unnecessary strokes. So waiting on erratic rhythms is not a good thing to do. If you notice that your engine in your heart and the gearbox is not working smoothly, please take attention. Please have ECGs. If you can manage your own ECGs, learning this device, go ahead. Otherwise, get help from your GP or your nurse or dial 111. And this last slide simply says, look how well we are doing with strokes, particularly in the London area, but any large city in this country. We're doing so well. Stroke unit admissions, 96% of people with strokes are getting into stroke units. Getting there within 4 hours, 60%. In London, this is now over 85%. So you're so blessed to be in London and Manchester and Birmingham, the large cities. 90% of those are inpatients in the stroke unit. We're hitting almost 85%. Scans within 24 hours. In fact, within 4 hours, 90% of people get scanned within 4 hours of this calling because you've got symptoms of stroke. Within 20 minutes of arriving at the hospital, most people are getting their CT scanned. Amazing things. Blood thinning medications in 2016 were 12%, but that's increasing now. And Nistha will tell you about the swallowing assessments are being done and mood assessments are being done to make sure you're not depressed before you go home. So all of these things are occurring really nicely. You know, so nice. I'm seeing that. So this is just a flow chart of how we think about these important aspects of stroke. We check your swallowing, we check your mood, we check your balance, we check your vision, we tell you about your driving ability, we tell you about preventing future strokes, your blood pressure, and all of these things are managed to prevent that. So blood thinners and all those medications, cholesterols are lowered. And so all of these are targets. There's a real clear framework. કેવી રીતે આપણે સ્ટ્રોક નું બધું ઓછું કરવાનું કન્ટ્રીમાં બહુ ફાઇન રીતે આપણું ગવર્મેન્ટે બધા પોલિસીસ કર્યા છે. આપણી રોયલ કોલેજીસ, આપણા ન્યુરોલોજી સ્પેશિયલિસ્ટ બધાએ સ્ટ્રોક સ્પેશિયલિસ્ટ કર્યા છે. આ પ્લાન્સ ને ફ્રેમવર્ક્સ બહુ ફાઇન રીતે બધું ઓર્ગનાઇઝ છે. એટલે આપણે વિચાર ચિંતા ન કરવાનું કે કાંઈ we shouldn't be worried when these things happen. We should trust in the system to manage this. These are one of those things like heart attacks and strokes, and COVID is managed brilliantly in the NHS. The NHS is an incredible place to look after these emergencies. So I really want you to have confidence in the system. Yeah? So last thing, my last slide, before I hand over to Q&A and of course to Nistha, etc., is prevention is better than cure. And you can help each other by one simple message. Let's go for a walk together. Let's meet to go for a walk. Let's not meet to go to a restaurant unless you've had your walk. Let's meet to go for a walk. Let's meet to go for a jog. Let's meet to go cycling. Let's meet to go play tennis. Jet and I love tennis. I play tennis all the time, etc. Heather, I'm sure you do. Badminton. Lawn bowls. Doesn't matter. Swimming is one of the best things you can do. Whatever you want to do, let's meet as a community to keep each other healthy. Use it or lose it. We have reduced stroke dramatically in this country. The UK is one of the first countries in the world that in the last 10 years, stroke rates have not gone up. They've actually gone down before COVID. The first country in the world to prove that, demonstrate it as a population, stroke levels are reduced 10-15% prior to COVID. We think there'll be a little lift with COVID, etc. There might be some flattening of the curve, and then we'll carry on doing that. And that's because you are doing your bit to know your cholesterol, know your blood pressures, know your sugar levels, and know your step count, your walking count, and you've learned how to take your own pulse, okay? And you've learned how to make sure it's a regular pulse. By doing these things and the fast component that I've shown you, those symptoms, face, arm, speech, any of those things, balance, vision, your hearing on one side suddenly goes away. Any of those things that's happening, please think of stroke and dial 999. And as I said, prevention and early action is what I really want you to remember. So I'm going to stop there. Heather, any closing comments from yourself?
I think this this webinar has wonderful energy, wonderful positive energy, which started with the great music that I wanted to dance to. And I would just reiterate what all of the speakers have said, and that is that this is a partnership. Empower yourself to do everything you can by understanding your own body, and then partnering with your doctors so that we can really do the best to help you. I'd like to also say, Chetan, you gave such a moving talk, and you showed how you changed your mental anguish into positive energy for change and taking on this new passion. And that is a real inspiration. You didn't wallow in the sadness of it. You got on and you made a new life for yourself, and that's really inspiring. I'd also like to mention, you said you didn't have enough physiotherapy, and I think this highlights an incredibly important point. Some neurologists say you improve for up to 2 years after a stroke. That's not true. You keep improving forever. So keep doing the exercises, keep working on things. There isn't a time when you stop improving after a stroke. And we really, I think that's a mislabeling of the situation. So we really need to keep working on these things to keep seeing movements forwards. And I think this webinar has wonderful energy for that.
Thank
Over
you.
to you, Prabhu, then.
Thank you, Amit Bhai. I loved your Gujarati. So when you keep saying "Mana nathi avadtu," I think, you're pretending. That was well. And Heather, thank you for joining us. I know it was very last minute for you, but you're really pleased to have you here with us. Both of you have given us a lot of food for thought, literally. And I love the idea of let's go for a walk together and do those things that actually keep us healthy together. So thank you for joining us. I want to say on behalf of Oshwal Association, of course, we think the NHS is a fantastic institution and, one that we are all very, very proud of the people that have come onto these webinars to share knowledge and information with us. And hopefully along the way, our community is getting a bit healthier. So really, thank you, both of you. I'm going to now introduce our next guest, who is here to talk about her job as a highly specialized neuro physiotherapist working with patients that have had strokes and get them back on the road to recovery. Very, very pleased to have Nistha Malviya with us today. Earlier, Nistha was telling us she has 18 years of experience working with patients, and she's going to share some of the work with us today. And particularly for patients like Chetan, physiotherapy is, of course, very, very important after a stroke and that recovery. So welcome, Nistha, and I'm going to hand over to you to share your where with us, as they say. Thank you.
Hi, Prafulla. Thank you so much for the lovely introduction. And it's a privilege to be here. Thanks for inviting me. So yeah, just about myself, I'm one of the neurophysiotherapists. I currently work in Brand Community Rehab. In addition to my bachelor's, I have done my master's in neurological physiotherapist. And since then, from my bachelor's, I've been working with neurological patients. So that's my field of interest. So I have over 18 years of experience. So I deal with patients, anything related to neurology, from stroke, MND, multiple sclerosis, brain injury, spinal cord injury, and many more. Let me share my slides. Excuse me for any technical glitch because my laptop wasn't working this evening, so I have to switch to my husband's, and I'm not great with Mac. So let's see.
At least there's some benefit of husbands, right?
And he's in IT too, so I had some sort of technical support, which helped. Can you see my slides?
Not yet, Nistha.
Okay. Let me. Give me a second. I'm trying to.
Just while you're doing that, I'm so pleased, Prafulla Ben, that you're doing these sorts of talks and these series and seminars, diabetes, blood pressure, lung disease, these are exactly the right things that, the population can benefit from. So prevention is something that the NHS isn't the best part of doing prevention. We firefight when problems occur, but you have to do the prevention. we have to do the prevention as people. I think that's quite an important point, isn't it? How are you getting on, Nistha? Are you okay, Nistha?
Yeah, just call my husband to check if he can, somehow can't.
Hey, double act.
I need
That's
to share.
While you're doing that, I just wanted to say we had so many lovely messages for Chetan Bhai on the YouTube chat. We've got lots of questions for our panel and about 369 people watching us. So amazing, amazing audience. And as you know, this is on YouTube, so people continue to watch them afterwards as well. So really lovely, and we're going to get a lot of engagement in the Q&A shortly. There we go. We've got the slides now.
Oh, good. Sorry about that. So can you hear me now? Yeah.
Yeah.
So yeah, thank you, Dr. Bakhai, and Dr. Heather. It was really a informative talk, and it would appear that I've cheated a few of your slides, so I can skip through those slides now. Regarding the stroke and things. So my agenda today is, talking about recovery after stroke. So I'll be talking how does a physiotherapy or physiotherapist can help you in your recovery. But to be honest, if I just talk about physiotherapy, it would be unfair to the other professionals involved. Stroke is not a condition that just affects one part of your body. It affects you as a whole. So, and it is the multidisciplinary approach where different professionals work together is the best way to go, because they work towards a common goal and help patients, improve their outcomes. So this is the same sort of diagram that Dr. Bakhai showed you and talked about how different areas of the brain can be affected depending on what area stroke has damaged, your brain in. So depending on the area where the stroke has affected you, you can present with different sort of problems or impairments that we called in our, scientific or medical terms. So first is the motor impairment. Motor means, in our language, the basic language will say means movement. So any problems or weakness in moving your arm, legs, trunk, mouth, face, or one side of the body can be motor impairment. The other issues that you can see is sensory impairment. So a patient with stroke can have reduced sensation or feel numb on half side of your body or part of their body, or on the other hand, can feel increased, a little stimuli like a touch may feel as if someone has, hurt your arm. In addition to that, there can be unusual sensations like burning, pins and needles that a person can, have after stroke. After that, there's cognition. So like Dr. Bakhai said, it's the way, your memory, intellectual, your problem solving can be affected. There's something called a spatial neglect, where you stop having, putting attention, or you sort of don't notice things on one side of your body. So as if you have no sensory input from that side of the body. So that's called neglect. So if you are a patient and you notice that you are having these sensory impairment or cognitive issues, like you're not able to remember, you're having problem solving, that's the point you need an occupational therapist in addition to a physiotherapist to help you sort of provide strategies and help you deal with these issues. Then we come to communication. So after having a stroke, you can see that it might be difficult for you to speak or understand. It might be both or vice versa. Then you might be able to speak, but it might be slurred or slow. So it might be difficult for people to understand. Then other problem is swallowing. So like we just said, the brainstem stroke, where there might be problems with swallowing. So you might find it difficult to swallow or chew hard, sort of normal food, or while drinking water or while having fluids, you might realize that you are choking off or coughing up. So if you notice, you're having these issues like communication, swallowing, the hospital will certainly, refer you to a speech and language therapist. But once you come back home and, sometimes symptoms can come later on. So at that point, you need to be referred to a speech and language therapist, and they would help you with that. In addition to that, there can be visual impairments, like you lose your visual field. So some people lose their central field, so they can see on the sides, but miss things in the center of their vision. On the other hand, some people might miss things on one side of their body, like if they have a left-sided weakness. They might miss things on the left side of their body. Something else is called visual neglect, where your vision is absolutely fine, but as we know, there has been damage or the connections have been lost. You might not put attention or attend to the things on the left side of your body. With these patients, you will notice that if you have provided them food, they will finish half of the plate of their food, whereas the half would be left without being eaten. Or they might bump into things or walk into people when they're walking, as they are not able to attend things on their left side or one side of the body. Then they are emotional, last but not the least. So if you notice you have visual impairment, you have to call your GP and ask for a proper visual assessment. Then last but not the least are the emotional changes post-stroke and the behavioral changes post-stroke. Emotional changes can include, if there has been a massive loss, isn't it, or after a stroke, as Chetan Bhai told us. So there's a grief that you feel. There might be frustration, there might be anger, there might be depression, and there are times that people feel suicidal. This can all lead to behavioral changes. So you might see people being more angry and aggressive after having a stroke, or you might see that they are very inappropriate in front of people, that says, in front of social inappropriate, they might pass comments that they would not normally wouldn't pass. So there's a change in personality. Or apathy, that makes you lose interest in anything, and you might not be interested in just anything. So if you notice in these changes in yourself, most important thing, speak to your family and friends so that they are aware of it. And if you notice these changes in a family member who had a stroke, make sure you call your GP, request medication, and request a neuropsychologist referral as an urgent referral. In addition to that, there are also sort of charitable organizations which provide great support to the families and people who are suffering from these problems. And to keep in mind, I can't stress enough, but if you have more of emotional changes and behavioral changes post-stroke, it will affect your participation in rehabilitation. It will affect your relationship with the family members. It will affect your personality. So it is important that you address these issues as soon as. So these were the impairments. Now I'm talking a bit about, recovery. So let's start talking about the recovery after stroke. And, that, as Dr. Bakhai said, very important to have a healthy lifestyle. I would say it's equally important if you had your stroke, life doesn't stop. We don't stop living. So it is equally important that you start from that day towards a healthy lifestyle if you haven't, because once you had first stroke, you are at risk of getting more. And like Chetan said, he had a TIA initially and then had a thing. Unfortunately, he had a healthy lifestyle. He was a very healthy person. So things can still happen. But yes, you have to continue working on yourself. So neuroplasticity, if I talk in normal, then it's like rewiring of the brain. It starts as soon as you had a stroke as a part of a recovery process, and it continues for years. So people say most of the recovery happens within 3 to 6 months, or as Dr. Heather said, it would be up to 2 years. But having said that, people continue to recover for months and even years after stroke. So it never stops. In addition to that, you should pay great importance to once you had the stroke. So the first 6 months to 2 years, you should focus all your energy and towards your rehabilitation so that you can make the most of it and create more and more connections in your brain, so that it will help you with achieving your goals and your recovery to stroke. And again, I'll stress it is really important to have a joint working with different professionals so that they have the common goals and they share your goals. So really important to speak to your therapist what is important in your life, because after stroke, you might lose a lot of function, but some functions would be more important to you than others, or some things would be more important. So speak to you, have a clear discussion with your therapist and set realistic short-term goals to start with. So now let's move on. My topic was to recovery with physiotherapy post-stroke. So let's talk to the problems that a person might have and come up with and after stroke and would need a physiotherapy for that. So the first and the foremost is muscle weakness because of the motor impairment. Then there are balance problems. So if it has affected the brainstem, there could be direct balance problems because of the stroke. But in addition to that, if you have vision problems, if you have sensory problems, if you have cognitive problems, and if you have neglect where you are not aware of one side of your body, you will certainly have problems. So it can be a combination of things. There's something called a spasticity, where you will notice the muscles have gone tightened, they are stiff, and they would not react to a stretch. So if you have a normal tightness in your muscle, if your muscle is tight, if you've done a run, all of a sudden you feel your muscles are tight, you stretch it and you feel better. But in spasticity, you will notice it goes back. And especially with these, the patients with spasticity will present that they will have a clenched fist, or at that you will see their arm is resting against their chest, or tight knees, or ankle position is in a very awkward manner. So this is called spasticity. So patients can present with that. Shoulder pain and subluxation. So what happens in subluxation? The arm bone comes or loosens out of your socket. And that can again be secondary to the muscle weakness, or on the other hand can be due to spasticity, because the muscles are tightened and they're pulling your joint, and also due to not proper positioning of the arm straight after the stroke. And this can cause significant pain. Another problem is foot drop. So when we walk, our foot and toes, our heel strikes the floor, and then our toes and foot turn upwards. But people after stroke can have weakness of those muscles, and then you can notice these patients walking with their foot rubbing against the floor, or sort of hitting onto the things when they're walking. The other problem is gait impairment. So people who have stroke and start walking, you will notice that gait is the pattern how you walk. So they might be walking, but the walking pattern would be very different to how they used to walk before a stroke. And that can again be because of the sensory issues, balance problems, and muscle weakness. Last but not the least, fatigue. Fatigue is another big issue after stroke. It could be just because your brain has such a big damage or shock, and you are just still recovering from it. The other thing can be mental fatigue, where like apathy, you don't feel interested in doing anything, or you are depressed, or you're feeling low. So in that case, fatigue, and that will again affect your rehabilitation and recovery post-stroke. Let's now move on to the physiotherapy input. So first and foremost to start with is the positioning. So as I said, there's weakness on one side of the body, there could be sensory loss. It is really important that you follow the positioning guidelines it would be provided you in the hospital by the nursing staff, therapists, or the doctors, to prevent further harm to the weak side. So the dark side shows the weaker side. So if you're lying on the weaker side, that should be how the pillows should be positioned to support you. Lying on the good side, this is the way how it should be positioned. And then there's, it is really important once you had the stroke, not to spend time in bed. As soon as you are medically fit, the nursing staff in the hospital will certainly make you sit up. So it is important that once you're medically stable, to do that, start sitting up. It would be difficult, but there are equipment and there are sort of techniques where they can make you sit. If you're still not medically stable, but still need to be in bed, there are techniques and there are positioning guidelines that you can still be made up to sit in bed. Let's go back to the therapy input. So from positioning, that is the first thing to start with. Then there are stretching exercises program. As I said, there could be spasticity, or their muscles could be tied. So therapists can provide you an exercise program to stretch your muscles. You can do active assisted stretching, which you can do yourself. There are stretching programs that the nurses, therapists, or your family members can help you with. If the muscles are not responding to this exercise program or stretching exercise program, there's something called as Botox injection that can help release or relax those muscles and give you relief with the pain and help you move your arm or leg better. In addition to that, you can also request the GP or get a referral where you can be prescribed medication for that. So after that is strength training. So a therapist will assess you, occupational therapist and physiotherapist will assess you, identify the muscles that are weak and then they need to be worked up. So these can be exercises that you can do in day-to-day activities. There might be specific weights that they can give you, or, TheraBand, or things like a glass of water or sort of a can to start with. That's strength training. Another important part is functional re-education, which a therapist will do. So once you had a stroke, just simple thing like turning and rolling in bed can become really difficult. And that's where the therapist will come and teach you and make you relearn to turn in bed, then roll in bed, then going forward, it's sit up to see if you can sit up at the edge of the bed, and then stand and walking forward. Same with the balance re-education. So once you had balance problems, and sitting can be a really big task. And even lying in bed, you might notice people with stroke moving onto one side of the bed when they have a neglect or, not attending one side. When you sit up, they are leaning heavily and they're falling all over the way. So there where your sitting balance education starts. Initially, we'll work on with assistance or without assistance to sit you at the edge of bed, then gradually reaching forward and reaching for objects. If you can manage then progress into standing, then standing balance re-education, moving forward to walking, and then working on your progressive speed and difficulty levels. And same like balance, therapists will work at the same time once you start walking on your gait re-education. So the therapist can teach you how to, initiate or activate your muscles to sort of get a normal pattern of walking, or with or without using a walking aid. That's called gait re-education. In addition to these, there's a very good site called stroke.org.uk where you can find loads of information. There is a 12-week stroke specific video exercise program which you can follow, which you can go, just click it and follow. You don't need a physiotherapist for that. That is like a homework that you can do for yourself. Another is the graded repetitive arm supplementary program. This is for the arm and hand. If you have weakness in your arms and hands, it starts from level 1 and moves to level 3, depending on how much strength and how much power or how much movement you have in your arms. This can again be downloaded. Your therapist can assess you for this and advise you at what level you are. So that's positioning. So let's go back to the shoulder pain and subluxation. So I talked about that, but these are, I've just got pictures of some of the slings and supports that we use, depending on what level of function and how much strength you have got in your arm to support your arm and reduce pain and prevent further risk after stroke. These are the hand splints and orthoses that are used for the people who have hand weakness. So you will notice that most of the people who have stroke might be able to bend their fingers, but it's really difficult to stretch or open their fingers. So they might be able to reach for things, but not release it. So these two other orthoses are very effective in such cases. And I have got 2 small videos to show you how they make a difference. We can get to that.
Here's an example of a client who is 6 weeks post-stroke. As would be expected at 6 weeks post-stroke, he has muscle weakness and decreased hand function and is unable to extend his fingers for any functional grasping and releasing. Here he is fit with the SableFlex dynamic orthoses, which prepositions the hand in a functional position in preparation for grasping. He is therefore able to use his own volitional flexion and relies on spring-assisted extension assist to release. He is therefore able to now participate in high repetitive, task-oriented, evidence-based treatment approaches. It is the hand that is critical to the functional use of the upper extremity. It is the hand that guides the arm.
So this was the first video. Sorry, give me a second. I'm not able to go back to my presentation. I'm unable to get back to my presentation. Still on. Thank you. So I'll go for the back for the next video. This is the second one that you can use.
Try to extend your wrist best you can. Go, 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 go. Squeeze, make a fist. Open. See what it was like without. Good job.
Yeah, looks good.
So that allowed you to be functional.
So yeah, so those are the two videos to show you how, you know, we can use different orthoses. In addition to that, there are also the foot orthoses. I don't know if you can see that in my video. There are foot orthoses that we use for the foot drop to support you when you're walking. In addition to that, there's something called as functional electrical stimulation. So as you know, you have a brain damage and, you know, sort of you have lost those connections. But this is a little electrical device that duplicates the same movement. And there's a little video that shows you how much difference it can make. So
the average salary
sorry, you have to bear with this ad for 5 seconds.
About £26,000 a year, depending on where you.
So you can see the person on the right-hand side, he's walking with his FES on, whereas on the other side, he's turning and rotating his feet. So that's about foot drop. Now I'll talk about the services available. So there are sort of different services available in the NHS and outside the NHS. So first is the hospital rehabilitation team that you will have straight after the hospital. From there, once you are medically fit to go home, you are then sent to the sort of ESD team, that's called the sort of early supported discharge. That is a stroke focused team. You will have the occupational therapist, physiotherapist, speech and language therapist, and neuropsychologist, and they can see you up for 45 minutes up to 5 times a week. But they have a certain criteria that you have to meet, and they have a certain criteria that you have to meet. But if you don't meet the criteria, there's community-based services where you can go and attend you can be an inpatient for up to 3 to 6 months, and you can have rehab input there. Once you are discharged from there and you had your therapy input, you have made recovery, and you are in a good position to go home, then you are seen by the community rehab team at home, which come at home, assess you, because, and you know, hospital setup are different. When you go home, you realize there's so much of a difference. The stairs are different, the rooms are different, the toilet transfers can be different. That's the point when the community rehab team will come and progress you from there. Once you are up and walking and attend the community, there's neuro outpatient that where you can be referred from going forward from there. In addition to these NHS services, there are also something called group. There are groups run by charity which you can access. There are online exercise programs which I have showed you. There are stroke clubs. There's GP exercise prescription programs. So you can use them and, you know, keep up with your progression. Key message which I'll say, you know, it will end up, and I'm copying Dr. Bakhai, but use it or lose it. So if you don't use your muscles after the stroke for long term, they're not going to come back on their own. You will develop something called as learned non-use. So you have to keep using it to improve it. Use it and improve it. That's repetitive training. So the more you use it, the better your brain will respond and the connections would be better. Practice specific. Doing a loads of exercises is not going to help. You have to be specific. Which muscles are weak? What have your therapist advised you? Be specific and work on those exercises. Work intensely. Follow the guidelines. Follow the number of times and intensity the therapist has advised you. In addition to that, these will all happen, but at the same time, it is really important to accept the impairments. Stroke can lead you and leave you with some long-term disability. It's important that you have an open talk with the therapist, accept that, and, you know, think of adapting your life, adjusting, like Chetan said, you have adjusting your life, finding new goals, new interest. And if you're still struggling, seek help, call your doctor, call the 999 for help. And there is a lot of help available, but it is you who have to take the decision and move forward. Thank you. I hope you find this presentation helpful and get a bit of insight where to go from and what sort of help you can provide yourself or anyone else in your family.
Thank you, Nistha, very much. And you struggled along with your technology there. It was really interesting.
Sorry about that.
No, not at all. It's really interesting, and I hope it's given people a lot of information about what is available and the role of physiotherapy, but all of your other colleagues that you mentioned, like the occupational therapy, the language and speech therapist, and other information that you gave our audience. I'm sure that was really, really helpful. Right. We have so many questions for all of you. So I think myself and Tushar are going to rotate the questions between us, and we're going to see how many we can get through. I've already seen about 24 questions. We're not obviously going to answer all 24, but and there are some themes developing. I just see Ameet Bhai putting his hand up. So what do you think?
I was just going to put the answers to about 20, well, about 10 of those questions into the screen here.
Right.
I don't know if you can see that screen, but that's got answers to loads of those chat questions.
Oh, okay.
I've literally taken those first few questions about devices, clopidogrel, the time after this procedure, what to do if you're weak and eat too many sweet things, etc. I've just put all those on. Unfortunately, I can only get 200 words at a time into the chat, so I can't put 2,361 characters in one go. So I've just put it on the slide for you.
Amazing. That's really helpful. Thank you. But I've got others that come into our mailbox. But do you know what? There is definitely a huge amount of kind of interest in this. We've still got 362 people listening to us, you know, after we've been at doing this for about over an hour now. So really, really interesting. There's just a couple of things I wanted to capture really quickly before we go to the Q&A. So both of you, Ameet Bhai and Heather, you both made some very good points about how we can help ourselves. And I think also the same theme came through in Nishtha's presentation about, you know, lose it if you don't use it. So I think we need to kind of think about those things, think about our diet, our lifestyle, and also some of the things that we can help ourselves with in terms of the devices, Ameet Bhai, that you showed us to, you know, look at our cholesterol and our blood pressure. I think the difficulty a lot of people have found, and correct me if I'm wrong, and this is post the pandemic, a lot of people are now trying to get appointments for their GP, to go to the GP when they haven't been able to do that for a long time. They've saved up a lot of their problems, and suddenly, you know, there's then an influx and an explosion of issues. And so trying to get the GP to perhaps look at some of these things that may seem a little bit insignificant for some things. So if you can do it at home, then, you know, it may well help to get you on that road to actually finding out what is going on. And then, you know, two things that you said about if you see those symptoms of a stroke, then don't hesitate. You know, do the 999 call, get yourself to a hospital, and, you know, get yourself seen to, and hospitals are equipped to do this really quite quickly. Nishta, you made some very good points, and actually takes me back 20 years when my mother had a stroke. And some of what you mentioned absolutely is what she went through. And, you know, 20 years later, we look at her now, and I know that her personality has changed. So it does happen. But on the other hand, you know, she's mobile, she's walking, she's talking, she's swallowing, she's fine. So things are, you know, as you said, recovery can be 6 months or it can be 3 years, 10 years, you know. And Chetan has just talked to us about his recovery. So I think it's not all doom and gloom. There's a lot of inspiration in the talk we've just heard from everybody. So what should we do, Tushar? Shall we read out these answers, or what do you want to do?
We'll go through. So thank you, Prof. Leppan. Firstly, Dr. Ameet, Professor Heather, and our specialist physiotherapist, Nistha. Excellent presentation. And you put it very simply that a person who is not medically, doesn't have the medical knowledge that all of you have, and you, with your charts and explanation, was so superb and excellent. Just to let you know that I'm a pharmacist by profession, but I don't practice anymore. So a lot of this, what you've been talking about, I'm aware of. Yeah. We move on to Chetan Bhai. Again, he had a stroke, but the most important bit, and this is what Professor Heather touched on, that once he had a stroke and difficulties, he did not sit back and just say, my life is over. He made an effort to improve his lifestyle, and he's still going to, I'm proud to say that he's going to doing cycling all the way to Paris next year, time permitting, and obviously COVID permitting, etc. The difficulty that we see as pharmacists quite often, that once a patient has a stroke and they become immobile and at home, they lose that willpower. When somebody's there, when a professional, when they go to the hospital for checkups or anything, they'll do everything. But once they get back home, or sometimes on their own, or the family member is not strong enough to push them to do the exercises or get them mobile again, that makes it your job a bit more difficult. Yeah. And that sheer willpower, they lose that willpower that I can improve on this. I can make my life better. So I think you touched on that today to say that we must carry on doing these exercises once you've had these difficulties. Yeah, and that's the most important point. Yeah. So I'll start off with, we've got a lot of questions. Of course, Ameet Bhai was, of course, all of you, I'm firstly also proud from all the Oshwals here and non-Oshwals, whoever's joining in, listening, that you've given up your valuable time, and we can see Dr. Ameet still in his hospital uniform there. Yeah. So the first question, obviously, this is quite easy.
Sorry, that's Ameet's pajamas, actually.
Oh, okay.
It's true. I'm ready anytime to work.
So the first question we received by email is, some people are switching to plant-based diets and exercise. What are your thoughts on it? Of course, I'm sure you're going to agree with that. Yeah. Dr. Ameet or Dr. Heather?
Absolutely, yeah. Look, plant-based diets, anything that reduces your total cholesterol, anything that reduces your sugars are good. But remember, your native diet, where you come from, your original diet, from which villages you come from way back, those things are genetically tuned to what you need. Whenever you adapt a more extreme diet, there will be fluctuations in your magnesium, your calcium, your zinc, your iron handling, your vitamin D, your calcium levels, etc. All of those things will change if that is not your genetically normal diet. For us, rotli dal shak, but not so much ghee and not so much food and not so much bhat, not so many calories, not so much bulk meals, etc., but smaller sections. Those simplest of things we used to eat, rotla, thodik rotla, thodik shak. Simple things are actually what is perfect for us, for our body. So Eskimos are much better at eating fish. Chinese, Japanese, Indo-Asian people love their rice and fish. That is their genetically attuned diet for generations. And the body normally knows what's good for you. You don't have to go extreme and then think, okay, I can handle that. That's going to be the best way in the future. Just don't take it as a fad. Take it because you want to avoid processed foods. Take it because you want to avoid harming other life forms, more complicated life forms. Take it because you're a Jain. That's fine. But don't go extreme and go, actually, you know what? I'm going to be absolutely ruthless and never eat anything because it's going to be harmful, etc. Just be in the middle in that sense, because you don't suddenly want to find out, oh my God, for years I've been low in vitamin D and calcium, and then suddenly find you've got weak bones. So just be careful about the research on these things. Heather, Nistha?
Yeah, I think that's a fantastic point. And just to add, really on the same theme, what we do, if we're really going to change our lives, it's not about the dramatic changes. It's about the daily small habits. So try adding one extra good habit each day. My house was a terrible mess. So I decided that every day before I went to sleep, I was going to clean the sink. That was the one thing I was going to do. And been doing that. And then because the sink is so clean, I feel, well, I might as well clean the rest of the kitchen. So it has helped me. That small thing of spending 2 minutes a day doing the sink has helped me to become a much better housewife. So you can do little things and add on to them and each day. So it might be that you're going to start with a walk. Do that 1 mile with a companion in the family. That's inspiring too. Maybe you don't need that extra bowl of ice cream, and you can modulate things. It's not about, as Ameet said, not about extremism, fasting for a week and in order to lose 20 kilograms. It's about daily things that will make a difference. And also, the more you do, the more empowered you feel to make other changes.
Great. So both of you said that same thing. It's about balance and about kind of introducing small things that we do every day in our life that makes that hurdle not seem such a big mountain to climb. So I'm going to stay on the subject of that, small things, small changes. Chetanbhai, what were the small things you did to overcome some of these challenges that you had?
So many small things. Diet was one, exercise. So I still eat, I still love my food. I've stopped drinking fizzy drinks. Instead of fizzy drinks, I drink water. Or even juices I've stopped now. I still use water as well. Exercise, I've started cycling, as you know. And just being positive. My main goal and my main reason for all of this is my daughter, she's grown up and I want to be there for her. And, nothing's going to stop me from seeing her graduation, seeing her get married and having grandchildren. And I'm going to make sure I can do what I can to make sure it happens.
Fantastic. I think London to Paris is definitely going to happen, right? So got a question. Is it good to eat beetroot instead of having beetroot juice or either for blood pressure?
The research that's been done is with a little glass of beetroot juice, 1 part beetroot juice, 3-4 parts water. You can put a little bit of, a little bit of adu or anything, salt, a tiny amount, etc. But generally, beetroot juice diluted. So the concentrates you can get, just dilute it with 4 parts water, etc. The research has been done that daily small glass of beetroot juice lowers blood pressure by 4 or 5 points. Yeah, but you can't really eat that much beetroot, but beetroots in salad is good. Now, just bear in mind, there are some people that have really low blood pressures, so please avoid having excessive beetroot in your salads and beetroot juice because you'll suddenly feel dizzy and lightheaded for that day. Yeah, rare people.
Thank you. That was really helpful. Tushabhai?
Right. So I have a question, and I think this is applicable to Nistha. My question is that after 1 year of stroke suffering, how long does it take to recover from slurred speech? And why are the legs still swollen under the knee to the ankle and spread to the toes? And the swelling is spreading to the toes as well.
Okay. Regarding the slurred speech, as Dr. Heather said in things, the recovery can be, months to weeks to years. So you can still improve. The good thing would be to speak to your speech and language therapist and have a review to see, if there are any more strategies or exercises that, that they can provide you to work towards your slurred speech. And repetitive practice. There's loads and loads of research that says the more repetitions you do, the more chances of improvement is there. Regarding the swelling, I would say there could be several reasons because of swelling. He might need to be assessed by a physiotherapist or a doctor. There could be medication. There could be lack of mobility. If the person is not able to use his legs or as much as he would like to. Or the other option is to raise yours. So initially starting, raising your legs and move your ankle to movement. See if that is making a difference. But yeah, if the swelling has been there and it's increasing, I would say, contact your GP and get assessed.
Thank you. Professor.
Great. So I've got one talking about, here we go. Would be very grateful if you can guide us. My husband had chest pains in March 21 and had to have another stent under pressure stent 14 years ago. Our confusion is he was given 80 milligrams of simvastatins beside other medications. Our question is, we eat very little all fat, etc. High dose of simvastatin and there's not enough fat for it to work on. Then doesn't this reduce the cholesterol to dangerous level and can cause Parkinson's?
So some of these complex questions about high dose statins, you're quite right that simvastatin 80 is something that we've always known as causing a lot of side effects. Most of us do not use simvastatin 80, and there was actually an MHRA statement that actually you should be on a torvastatin 40 or a suvastatin 20. Now, if you are getting muscle aches, if you're getting cramps, if you're getting neuropathy, hair loss, some of these rare side effects with statins, you can go down on the dose. So a torvastatin 20 or a suvastatin 10, and add in ezetimibe, so you can still get everything down to target. As to too lower cholesterol, please bear in mind when we are born and in those first few years of life, our total cholesterol levels are in the 1.5 to 2 range. So we are used to having low cholesterol. It's with age that our cholesterol starts increasing, 2.5, 3.5. Once we as Asians start getting cholesterol levels above 4, that's the same as Caucasians getting cholesterol levels above 5. Remember, most of the normal ranges have been done with middle-aged Americans in the Framingham data set, about 3,000 people. So our cholesterol levels need to be even lower than those normal ranges. And so actually, once we're starting getting above 4, that's bad for us. But the important thing is the ratio of the total cholesterol to the good cholesterol. If a lot of your cholesterol is HDL, good cholesterol, then you're still protected.
Thank you.
So that leads us to the next question, and one for Professor Heather. There's an individual who has a regular blood test for electrolytes, kidney, liver function, cholesterol, etc., etc. Now, obviously, there's a national level that it's measured against, yeah? Now, is it a national level that's applicable just to UK, or is it an international standard? And the second part of that question is, the levels that are set, average levels that are supposed to be there, are they unique for all different communities? So Asian, Afro-Caribbean, English, etc.
It's okay, Heather. I might jump in because my public health knowledge on those aspects as a research director, one of the things that I do is look into these things quite carefully. And the Framingham data set, which is now over 60 years old, was based on 3,200 middle-aged Americans. And so all of our normal ranges from then come from there. However, we have learned over the last 50 years in the NHS that some of these ranges need to be modified depending on your race. So if you have thalassemia, you'll have this. You know, if you are an Asian, you'll be this. If you have Black and ethnic minority, then this can be, the CK levels can be slightly high. But those subtle adjustments aren't really there. The normal ranges are still valuable for us. And even within the normal range, it isn't what your level is, it's what's the direction of travel of that normal range. If you start with a total cholesterol of 3, which is normal, and go to 4 within a year, that's wrong. Okay, you should only be going from 3 to 3.2. You should have a 5 to 10% change only. If you suddenly have a 33% jump, even within the normal range, within a year, your total cholesterol is going totally the wrong direction. So we're starting to learn all these things because we're accumulating. The UK Biobank project in the next year or two will completely change these ranges and make them genetically appropriate to if you're an Asian migrant, if you're a Polish individual in the UK, if you're, you know, we'll have more data from the UK Biobank project than ever before in the whole world. You know, it's one of the most fundamental projects being done in the whole world. Literally 500,000 people have been dedicatedly every year tested with their blood tests. They've got CT scans, X-rays, everything going wrong, anything going wrong with them. You know, that ask us again in 2 years about specific ranges for specific races who are also migrants. Remember, it's not your range from where you come from. You're a migrant in this country, so that's a different range again. Is that all right, Heather?
Yeah, that's a brilliant answer. So over time, we're going to be able to tailor the individual treatment enormously and also take into another factor, which is individual variations in how people metabolize different medications based on their genetic profile. So we're going to be able to use this very smart technology to refine it. And it's incredible, the scope of that. In the meantime, there's plenty of things for us to be getting on with exercise and all those other important things that Ameet and Nistha have highlighted for us. So lots to do already.
Brilliant, thank you. So next question is actually for you, Nistha. It says, there's no support for stroke patients after the initial 6 to 12 months. Is this because no further therapy can be done?
I think you need to, so there are, as I discussed at the end of the slides, there are different options. Once you are discharged in the community, after 6 to 12 months, if you have potential to improve, the way we work, we ask patients, we have discharged, but that doesn't mean you never see us again. You go back to your GP, you say you have been working on this, there have been some improvement, and you want to see a therapist again for an assessment. And I think you can then see. In addition to that, as I said, there are a lot of charitable organizations. There's a lot of clubs that you can join. There's something called as GP exercise prescription program. It depends from borough to borough, but that is something that you can access through your GP or a therapist can refer. You then get a personal trainer, one-to-one. There's some funding for that and the charges are very minimal, and where you can go and access one of these gyms on a regular basis, 7 days a week. So these are the options for you, but yeah, you need to go back to your GP and discuss that.
And you do give exercises and the charts for people to do at home as well,
Yes.
don't you? And I know people find that really quite challenging, and they often get behind doing those. So I guess there's those as well, isn't there?
Yes, and then there are videos on the stroke.org stroke site. There are loads of videos that you can click and follow. And you have to take some ownership and self-motivated for that.
Great, thank you, Tushabhai.
So
We've got so many still to do. I think we can only take a few more because look, I'm just looking at the clock, and this is probably our longest session, guys. So yeah,
this is an important topic, and as I said at the beginning, every person out there that knows somebody, whether it's within the family or relations or a friend who's going through this difficult phase, this illness. So important question. I don't know whether you've answered this already in your write-up. Dr. Ameet, please explain atherosclerosis and what happens if you eat sugar, what happens inside the blood arteries.
Yeah, atherosclerosis is a furring up of your arteries. Now imagine the hose pipe in your garden. If you just leave it lying around, you don't take care of it, it will build up dirt inside, and it will have calcium dirt, and you can feel the brittleness when you then break it after a few months, etc. You roll it up. So all of these processes, water is not clean. It has little minerals in it that line up in the arteries. The blood is not clean. Now, atherosclerosis, a furring up of the arteries of all of the body, start from the age of 18. From the age of 18. Now, it's how quickly it occurs that makes it bad. If your cholesterol is really high, you can have heart attacks in your 20s and 30s. So if you have cholesterols over 7 and 8, if your blood pressure is really high, you'll have heart attacks in your 30s and 40s, particularly if you've got cholesterol and sugar. Your diabetes levels. So first of all, high blood pressure punches holes in your vessels, and then the cholesterol and sugar gets in as dirt. It creates rubbish inside the vessels, and the cells that go in to clean that rubbish get stuck inside those vessels themselves, and they engorge the rubbish, and they just sit there and can't get out, and they're called foam cells. And so what they do is they start blocking inside the artery. And so artery blockages is where atherosclerosis ends up becoming clots in the arteries. So clots that can rupture, plaques that can rupture, etc. So imagine a little mountain inside your artery. It can then erupt when like an infection or stress occurs. And then when it erupts, all the cells come along to put out the fire, and they cause a clot in the heart or brain. And that's a brain attack, a heart attack, a lung attack, etc. And so those are the natural progressions. Now, somebody's talked very nicely about yoga, breathing exercises. All of those things are really good. Absolutely right. Anything that improves flow, heat yoga, hot yoga, anything, breathing techniques, your music, the singing, the mantras, any of these pratikamas, etc. 42 minutes of rigorous focus exercise. Any of those things will help you. Just being fulfilled in your life, fulfilled with your work, in love, all of these things will help you actually stay healthy as well.
Thank you. Shall you take one or shall I take one?
Oh, you take one, go on.
There's a question that's come through. It's not on the YouTube. Now, during the pandemic, the COVID, obviously the doctors were not seeing anybody. It was just phone consultations, etc. Now, obviously, a lot of people's health has been affected in that sense that the patient could not go and see the doctor and talk to them face to face in a comfortable manner because the doctor was always under pressure to just give a phone consultation. Has the number of strokes or other illnesses related to the heart actually increased during the pandemic, or is it the same levels? Dr. Heather?
I think Ameet actually mentioned that the reduction in stroke, which we'd seen before COVID, it's gone up a little bit. So we have had a worsening of a lot of these events. We've got a lot of work to do to catch up with that and then to get things back on the right pathway. So COVID has had a massive effect in just about every sphere of life and medicine. But rather than looking back, we need to look forward and be working together to reduce those risks again and get things back on the right pathway of reduction. I'm sure, I mean, you might want to add some more things, more actual figures.
Absolutely. It's really, really important that first of all, we take self-responsibility for our health. The more we can do well, the better. Now, if you're in trouble, you can write things down and submit them to your GP. They will look at them as emails and decide, they'll triage really carefully. I need to see you physically, or I need to get some blood tests done before I see you. They can actually, the more intelligence you give them, the better things can be managed. Now, for decades, we have not had enough doctors and nurses in our country. For decades, we've underinvestigated. We've reduced our inpatient bed capacity. The government has slashed hospital beds, etc., and said, "Oh no, we can do more with less," etc. And so what we're seeing is, in the face of a pandemic, all of a sudden, all of those things, those cuts that we've been making, cutting right down to the bone, putting doctors off and even training in medicine, putting nurses off. A lot of people are going to Australia and New Zealand, as Heather will attest to, because their quality of life is better. Making our staff more miserable in the NHS by saying it's your fault when actually it's not their fault, the pandemic, self-responsibility, you're planning ahead, you look after your car. If all of a sudden a whole load of cars start crashing on the motorways because we're not driving them properly, oh, do we blame the motorway people? Do we blame the car designers? You were given a perfect body. If you look after your perfect body, that is the best way. Even if a problem occurs, like Chetan, you still have a perfect body. In fact, his body is even better now. He is less likely to have a second stroke than I am to have a first stroke because he's doing more exercise and he's looking after himself far better than I am. So our GPs are doing an amazing job under really difficult circumstances. Our pharmacists, fantastic jobs all the time. Our nurses, our community folks, physiotherapists, everybody is doing an incredible job. The media love to make more papers and more news, and they will do it however you want them to do it. If you think that's the way you should think about things, then you don't really have your own choice, okay? Why don't you let the media tell you you're sick and then you'll be sick because you want to believe what they tell you? Your job is to believe in yourself and get it right. People are here to help each other. We're a human race. We're so blessed that we don't have to pay for state care. We have the NHS and GPs. We don't have to pay for them. It's an amazing system. There's no system better in the planet at the moment. So sorry to be overly passionate, but this is wrong to say we can't see people. No, they want to see the people they need to see, and they are prioritizing the orders. And there are lots of other ways we can get help from our pharmacists and everybody else. We can get help from our own community. We can get help from people who are more experienced than us. Patients love helping patients. Yeah.
That's some great advice there, and very passionately delivered as well, I have to say. And we are, we absolutely get it. And I guess there are, pockets of problems. You do hear a lot about GPs not still seeing patients. A lot of people are not used to the digital technology. So, there are kind of issues like that as well. I think, Tushapa, I'm going to take one more question and then you're taking one more and then we're done. Okay?
Yeah.
So my question is, can oxygen deficiency, i.e. weak lungs, cause strokes?
Absolutely. Any stress on the body will cause it. So weak lungs, low oxygen. If you have a chest infection, the commonest time to have a heart attack or a stroke is the month after a bad chest infection or bad pneumonia, because you're putting so much strain on the body. It's a really simple answer. Any stress on the body which you're not used to, that is unexpected or sudden, will do it. On the other hand, if you're going to go and climb Kilimanjaro and get used to the low oxygen levels, that won't cause a stroke. That will make you stronger after you've come back from Kilimanjaro.
Okay, so last question. Well, I'll make it into two questions. Sorry, Professor. You talked about a device which helps you measure your pulse, your heartbeat, etc. What is that device called, and where do you obtain this from?
So all of us are using pulse oximeters, right? So we all know about putting a sensor on your finger, a pulse oximeter to do your oxygen levels and your heart rate. That's great. The Alive Core Cardia 6L, which I've put in the chat, Alive Core, C-O-R, Cardia, K-A-R-D-I-A, 6-lead, 6L, is available online. It's about £150 last time I looked, etc. But get the 6-lead one, not the 1-lead one, etc. Now you can get some of these devices loaned to you by some practices have got them. NHS Digital has bought a lot of these devices and given them to deprivation area practices to loan out. And of course, at the hospitals, we put in things like 7-day monitors on you. We put 28-day patches on your skin that can monitor your ECG for the whole 28 days. But also for rare people, if we can't catch it, we can put little devices under your skin, inject them, little USB sticks that are monitoring your heart rate for up to two years battery life. And then we put those in, it takes 5 minutes. Implantable loop recorders. They're really expensive. They're £1,800 to £2,000. And so we don't put them in everybody. Whereas the patches and the 7-day monitors and things like that, you know, a few £100, etc. in the NHS. So we can afford those for many people. We can't afford the loop recorders for everybody. But as the technology prices come down, you know, you will have wearables. Now, guess what? There are now technologies that while I'm looking at your face, I can monitor your heart rate and create an algorithm to detect whether you've got an irregular heart rate. So as I go past this camera, CCTVs will be able to have softwares on them. When you're watching a movie at the cinema, we can actually monitor your face and look at it and go, hey, you've got an irregular heart rate. Did you know that? So there are new technologies coming along that are so simple that from the blushing of your face, we've had them for years, that I can monitor your heart rate and even tell you if it's going erratic. So these technologies have become really rapid, really fast. And of course, the Apple Watch has 1-lead ECG. It's not perfect, but it's still good.
Okay. So the final question, what are your thoughts about taking baby aspirin or aspirin 75 milligrams once you start past the middle age? To keep
saying this final question, doesn't he? And then one more.
Well, you're making the most of you being here, right? Both of you. That's what it is for all of you. Yes.
There is a really important website, okay, called the QRisk. Okay, so QRISK.org, QRisk.org. Okay, please go on there. Everybody go on that website. Okay, www.qrisk.org. Put your age in, put your postcode in, put your ethnicity in, put your family history in, put your blood pressure, your total cholesterol, and your HDL. Even if you don't know them, put them in. Leave them blank. It will work out an average for you. It will tell you what is your 10-year risk of death, stroke, or heart attack. And if it's over 10%, your 10% chance of not making it through 10 years without death, stroke, or heart attack, you are considered high risk. And those patients who are high risk are eligible for statins, ACE inhibitors, aspirin, beta blockers, providing you don't have a risk of bleeding. So diabetics are a little exceptional, so you've got to make sure you don't have a risk of bleeding in your stomach from aspirin before we give it to you. But everybody else, over 10% 10-year risk of death, stroke, or heart attack is considered high risk. Aspirin will reduce that by 20-30%. Clopidogrel will reduce that by 20-30%. The cholesterol elements over 4 years will reduce it by 20%. The beta blockers, ACE inhibitors will reduce it by 10-20%. You can get that risk right down to around 5-6% with the right medications, exercise, the right diet, and the right prevention. But use that risk score. It's really powerful. It's specific to the UK population. So your deprivation area, if you're in a bad postcode versus a good postcode, changes your risk factors, etc. Yeah, really useful.
No, thank you.
Amazing. Right. So leaves me to say thank you to all our speakers today. Absolutely amazing session. Really, really helpful. So thank you, Ameet Bhai, for joining us. Thank you, Heather. Thank you, Nistha, Chetan. Thank you so much. I know it wasn't easy to share that story, but you did it, and I think it's inspired a lot of people. So our next session is going to be about osteopathy. In 2 weeks' time, we're going to talk about osteopathy. So thank you, everyone. Tushabai, thanks as always. And I'm going to thank our team doing the admin and the tech today, Nikunjbai and Hemelben. Without you, we couldn't have done this. So brilliant. Thank you very much.
Thank you to you guys. Thank you for doing this, looking after your community.
Wonderful organization and wonderful energy, fantastic positive energy. It's really inspiring.
So can I just...
I am going to be doing a migraine session a little bit later on in the year, and it'd be great if you could come back to talk about your favorite subject.
That will be a great pleasure. Yes, thank you.
So, Professor Ben, one important point, and we must finish on that. The team today here has passed on a very important message. Yeah. Yes, as you get older, we get different sorts of illnesses. We have to take medication. Some is unavoidable, some you have to take, no doubt about it, yeah? But as a pharmacist. But the most important advice, I think they've all given us, and today we have a living testament, Chetan Shah. Most important aspect is exercise and fresh air. That is the best food for your family, for your body, yeah, for your health. And I think that's a message from all the three professionals, and Chetan Bhai has actually displayed that he did not give up, he persevered with his illness, and made sure that he still exercised, got fresh air in, yeah? So best medicine for everybody, rather than eating pills all day long.
Absolutely. Thank you, everyone.
Thank you.
Good night, everyone.
Thank you.
Bye-bye. Bye-bye.
And don't forget, happy Diwali, guys.
Yes, happy Dussehra.
To you as well.
So stay online. Yeah.